over to Sharee Schumann.
Good afternoon, everyone. Let's go ahead and begin our webinar. Welcome to the webinar today on mobile apps for the community and law enforcement to assist vulnerable adults, facilitated by the National Alzheimer's and Dementia Resource Center, which consists of our team at RTI International. I'm Sharee Schumann with the Resource Center team, and I will be moderating our webinar this afternoon. The purpose of these webinars is to provide helpful, current, and applicable information for ADSSP and ADI-SSS grant projects and others in the Aging Network. Please note the webinar today is being recorded, and the PowerPoint presentations will be sent to all of you soon after the webinar. We will allow time for questions through the webinar's chat feature at the conclusion of the presentations. If you have a question during or after the presentations, please enter your questions into the chat feature. At this time, I'd like to turn it over to Erin Long from the Administration on Aging, Administration for Community Living to provide a brief welcome.
Hi, everyone. I want to thank you for taking the time to attend this webinar. We're very excited to learn about how technology is going to be able to assist us as we work with persons with dementia and their caregivers. With that, I'd like to turn it back to Sharee so she can tell you more about who's going to talk to us. And again, thanks to our presenters and the Resource Center for putting this together.
Thanks, Erin. Today we'll hear from Dave Cardell and Sharee Rines. Dave Cardell is the founder of EyeOn app, a company focused on extending independence for seniors. Before starting EyeOn app, Dave had been in the software industry for 18 years, opening international offices and building teams for sales and delivery of complex software solutions for large enterprises across Europe, Africa, and the Americas. Dave holds a Bachelor of Science in Mechanical Engineering from Baylor University. We'll also hear from Sharee Rines, who is the trainer and policy writer for the Georgia Adult Protective Services and has served in that role since 2010. She has been an active member of the National Adult Protective Services Association, chairing the Communications Committee, sitting on the Education Committee, and the Curriculum Development Subcommittee. Sharee, along with other Division of Aging staff, worked with the EyeOn app to create Georgia's GAIN, Georgia Abuse, Neglect, and Exploitation app. Sharee Rines is also a graduate of Georgia State University and has degrees in psychology and sociology. We're going to start with Dave Cardell. He's our first speaker, so I'll turn it over to him.
Thank you very much, Sharee. I've just put up a quick agenda. We're really going to go through two different apps. One that I originally designed myself, and it was the way that I was introduced to the Division of Aging Services in Georgia that led to our relationship, and then the second app, which Sharee will talk about, which is the GAIN app. If you look at two screenshots of these apps, we're going to go in the order of Sharee first, which is the GAIN, which is one on the right. The one on the left was originally called EyeOn app, and that still is available. There's also a Georgia-specific version. I originally designed this with my mother in mind. So I was living in Atlanta at the time. My mother was living in Texas. And although she's healthy and fine, she does live alone, and my sisters and I worry about her. And I realized, you know what, I speak to my mother once a week, and there's just so much that can happen in between there. And we looked at the market. We tried to figure out what types of tools could we implement in her home or for her, and really came down to there was nothing that fit the lifestyle. You know, there are a lot of interesting products out there, but nothing that fit her lifestyle. And I realized that she's walking around with basically a computer in her pocket most of the day, and that we could utilize that to enable us to not necessarily track her, but get notifications and alerts if there might be a potential problem. And I'll go through that after Sharee goes to the next, and how we designed that. And I actually employed a group called the Institute for the Ages in Florida to help us gather some information and how people would want to interact with a tool like this, and how they helped us create and design that. Through that app, while I was living in Atlanta, I met the director of the Division of Aging Services, and this is how we branded a version for Georgia based on some of the cost savings that they could generate by keeping people living independently. And I'll go through again in a little bit some more of those details and specifically some examples on how they see the cost savings actually happening. And then with that relationship, Sharee and her group, the Adult Protective Services, contacted me and said, hey, we have a great idea for a completely different audience. It's helping law enforcement when they have interactions with potentially at-risk adults, so either victims of abuse, neglect, exploitation, and how can we help those law enforcement officers be able to, A, better identify those victims and identify them quickly, and then B, what do they need to do in that situation and help them work through that. And Georgia has a training program that they put through, and I don't want to speak too much on this, as I'm sure Sharee will go into some detail, but a training program, and at the end of that training program, there's just a lot of things for people to remember, and so we've basically consolidated all of that, or a lot of it, into a very easy-to-use app for the law enforcement to reference and to have the screenings and the questionnaires and contact information and things of that nature. So very different audience. One of them is for people living alone. The other is for helping and providing tools to law enforcement. Those are the two apps. And Sharee, I'm gonna hand it over to you and let you talk about GAIN a little bit, and then I'll come back in and talk more about the EyeOn, or the telephone support for seniors.
Hi, this is Sharee Rines. For some reason, I've lost my visual and my ability to move the slides along, but hopefully you can hear me just fine. And Dave, I'll just kind of let you know when to move the slides forward. I do apologize for
no problem. I can do that for you.
what's going on. Okay, so as Dave already said, GAIN stands for the Georgia Abuse, Neglect, and Exploitation app. We were partnering with sorry, I'm thrown off because I can't get my computer to work. But we were partnering with NAPSA as well as with Wells Fargo a few years ago, and in doing so, we had a presentation on financial exploitation, and at the end, they had us all make a pledge to do something new and interesting to go out and protect people, and particularly around financial exploitation. But when we thought about it, we thought a little bit bigger. And one of the examples that Wells Fargo gave at the end of the presentation was that Minnesota had developed an app as a part of their pledge after they had a similar presentation there. And so I brought that information back to our director, and we said, well, how can we go beyond just financial exploitation, and how can we incorporate some of what Dave was talking about was the work that our forensic unit was doing with law enforcement. And so they had developed a training, particularly for law enforcement, to look at issues of abuse and neglect and exploitation. In Georgia, it's always been a part of our law and a part of our policy that APS goes out and they do the investigations of abuse, neglect, and exploitation, and they should be working alongside law enforcement and turning over any information that we have on substantiated cases to law enforcement. However, we have 159 counties, and in some situations, as we were turning over that information, we were getting replies like, this is a social service issue, why are you giving this to us? And so as a part of our elder prevention program, we decided we would take those funds and really focus really hard on law enforcement and training them, and then we would move on to other areas of the community. And so two lone people, a former forensic nurse and a former investigator for a local DA's office, they started our forensics program, and they started training law enforcement. And as Dave said, at the end of that training, they gave out this booklet that's probably 100 pages of all the information that they had given law enforcement. And what they needed them to have as takeaways. And so we thought, how can we put some of those things into an app? And so that's what we did with the GAIN app, to try to help law enforcement deal with frequent situations that they encounter of abuse, neglect, and exploitation, and also dealing with issues of encountering individuals with diminished capacity. We had a couple of situations in Georgia about 3 years ago now where law enforcement had encountered seniors in somewhat unusual situations. One was a senior who was out in the middle of the night in his pajamas, and when approached by law enforcement, he said he was going to get the mail. This gentleman then wandered onto a property that he had lived on many years earlier, had tried to jiggle the doorknobs to get in, and the new owner, afraid that they were being robbed, pulled out their gun and shot the older individual. We also had another encounter where law enforcement had pulled over an elderly woman who said she was a little lost. And a few days later, after he gave her some preliminary directions, they found her in a ditch, and this was wintertime, and she had expired. So law enforcement are always trying to juggle that line between encroaching on somebody's rights to be out anywhere at any time and protecting the public. And so how could we also include features in here that could help law enforcement discern when they should intervene and when they just simply give directions and let a person go on their way. And so those were all a lot of the things that we were trying to incorporate into the app when we got started. So the app also serves for social services individuals who are out there in the social service field. It has a lot of features that will direct people to resources as well. So while we had law enforcement in mind when we initially started this, we expanded to include people in the social service field as well. How can we help them find resources, as well as our regulatory agencies? How can we connect with them and keep people from doing double work? Who do you contact and when? Adult Protective Services, we do our investigations in the community, but we have someone called Health Care Facilities Regulations. They do all the adult abuse, neglect, and exploitation cases in long-term care facilities. So directing people of who to contact and when was also a big part of the app. So let's move on to some of the special features that we have for some of the professionals that are out there. So we have screening questions that have an algorithm to help figure out cognitive functioning with individuals. One of those screeners deals with the situations that I was speaking about with law enforcement, where they encounter someone and they're not sure how much they need to intervene in that situation. Should they let the person go on their way, or do they need to really figure out who this person is, where they belong, and then help them get back there safely? And by working with the Alzheimer's Association and with Dr. Toomey at Emory University, he is a neurologist there and geriatrician, he came up actually with just a few short questions that law enforcement could ask in those situations to help them figure out, should I let this person go on their way? They originally started handing those questions out on the back of like little business card size note cards so that law enforcement could keep them in their wallets, but we also implemented that into the app. We also have screening questions with an algorithm that will help determine abuse, neglect, and exploitation. And for that, we leaned on a professor out of Illinois. He has allowed us to use his screening questions in order to figure out, is there abuse, neglect, and exploitation going on with an individual? And so they're just kind of quick questions and yes and no answers. And if you get enough yes answers, it directs the person to please make an APS report. And then the last one, we worked with UAB, University of Alabama, Birmingham, to help develop a financial capacity tool. When individuals are sometimes early in dementia, they lack executive functioning, but may be higher functioning in a lot of other areas. And so we've been working to kind of hone in on those executive functioning, financial capacity, decision-making type things. And so we have a longer screener that was developed for use by APS, but we wanted a short screener that could be put into the app. And again, everything on the app is very short and to the point because it was designed for law enforcement on the scene to help them make quick decisions. Other special features are the emergency placement feature. So in Georgia, we have a small pot of money that allows us to place someone for up to about 5 days into a personal care home type setting. And this pot of money can be accessed by law enforcement, APS, or our regulatory agency who also does investigations. And so how can they go from screening the person to figure out if they need to do a greater intervention to if they can't figure out where this person needs to go, how do we get them to a safe place? And so our TURF funds allow us to help with that, and so that can be accessed directly through the app. Maddie's Call is a law enforcement tool, and while it doesn't initiate a Maddie's Call, if you're already in the app answering questions, trying to figure out what's going on with this adult, you can then quickly link into the Maddie's Call system as law enforcement to get that done. While our app is for both the public and law enforcement, some features are only for law enforcement and our APS workers, and Maddie's Call is only for law enforcement. We also have push notifications that will alert people who have downloaded the app to any scams that are going on. So we often get the newsletters from law enforcement, from our sheriff's department, from other agencies, alerting us to whatever the most popular scam is at the time that is showing up a lot for law enforcement. And so we do push notifications to send that information out as well to our users. And I hope you're able to keep up, Dave, and I'm not totally losing you. So we can move on to a picture of the home page of the app. So it's pretty easy to access with the screens. There is a code that law enforcement and our APS put in order to be able to view more features than are currently showing on the version that should be on your screen right now. With the help of our GBI, our app is available on not just iOS, but also on the Windows Phone as well as Blackberries. So GBI used some of their funding to expand the areas where we can have our app. So one of the tabs within the app is the Reporting Agency tab. And so this has a lot of the agencies that do investigations of some form or another. And so there's Adult Protective Services, our healthcare facilities, the ombudsman who go into facilities and try to deal with resident conflict, our behavioral health, as well as issues of fraud like food stamp or Social Security fraud. And so whatever situation that you're encountering, you should be able to find a resource for that. There are also general resources within the app as well that tell about other services in the state, like our Elder Legal Assistance Program, the Alzheimer's Association, as well as AARP. Information on how to contact all of these agencies can be found within the app. We also have a law tab. And so APS gets its authority through the official code of Georgia. And so we put in all of the codes that, kind of say where APS intervenes and how we intervene. But not only that, we put in codes that also deal with situations that law enforcement may encounter on the scene. There are also tabs that can assist district attorneys in figuring out what a person can be charged with. So while there is a section of the law that deals particularly with elder abuse, there are a lot of other things, other crimes that are occurring simultaneously when you think about, just simple battery charges or, other things that are a part of that abuse, neglect, and exploitation, but are additional charges that can happen. So we work with our legal department and with one of the DAs in one of the counties who is particularly good at prosecuting these types of cases to figure out what laws, what sections of the code would be very helpful for law enforcement on the scene, as well as district attorneys around the state who haven't encountered these types of cases. Our forensic department unit, they frequently get calls from district attorneys saying, we haven't ever encountered this type of case. Help us figure out, how to walk through it. So while our forensic team is always available to answer those questions, this is a place for them to start with their questions. So we also have the placement tab, and the placement tab first looks at care facilities, licensed care facilities. Like a lot of places around the country, we have issues with a lot of unlicensed personal care homes popping up. And so by giving the community as well as law enforcement a quick link into our healthcare facility regulations website so that they can look up an address, they can look up the name of a care facility to see if they're licensed, so that family members who are looking for licensed homes for their loved ones can can connect to that resource through the app as well. But then we also have another placement feature in there that's called TURF. And this tab is for specifically the situations that I talked about earlier, for law enforcement, for APS, for our regulatory services, to when they encounter someone who needs emergency placement. It's temporary. It doesn't pay for them to be there long term. But if there is an adult whose caregiver is absent for any reason, that can be illness. There have been occasions when the caregiver has a health emergency and has to be taken to the hospital. And when law enforcement who may be on the scene or EMTs on the scene look into the back bedroom, they notice, there is a vulnerable adult there who can obviously not be left alone. Previously, that person might have also been taken to the emergency room, but because they have no acute symptoms and do not need acute care, the emergency room is not the appropriate place for them. And so through help from our legislature, we were given a pot of money to try to figure out how can we prevent that from happening. And so the TURF funds were developed. And once it was developed, how can we make sure that law enforcement has access APS is Monday through Friday, 9 to we needed and
Again,
these
it
beds
sounds like his sound was
7 days
muted.
a week, 24 hours a day. And so as we were developing this app, this pot of money also came available, so it was somewhat serendipitous that we could combine the two things in order to help law enforcement deal with these particular
So everyone
situations.
could just sit tight for a minute.
Again, the reporting of missing
Sharee, you might
adults,
be able to
you
answer
have
one of the
Maddie's
questions
call,
that
which
came
is
through while we're
when
getting
law
Dave
enforcement finds
connected.
out that there's a vulnerable adult missing. But we
Do you
also
have
have
any
Safe
numbers that
Return,
report on the
which
frequency
is
of use
through
of
the
the GAIN
Alzheimer's
app by law
Association.
enforcement?
And it's when law enforcement or any citizen encounters a vulnerable adult who's wandering and
Okay.
doesn't know where they are or how to get back home.
Okay,
It gives instructions through the app for them to look for the Safe Return
Oh, I'm
bracelet or
sure he'll get back
neck
in just a
pendant
minute.
to see if they actually are
And
registered with Safe Return.
yes, we can
and
hear
then they can
you.
call that
We'll
number
move
and
back to the
access it
questions
again
after your
through the app
presentation.
to try to get that person to safety. So that's another feature that we added into the app as well. And I don't know if I mentioned this in the beginning, but we partner with the Alzheimer's Association in creating this app. It was created through funding through a federal grant for systems integration. And so we also partner with Alzheimer's Association with that grant to help get this app out initially. So some of the features that we have in here do keep in mind the individual with dementia, with Alzheimer's, to try to help law enforcement and the community in those situations. So the next tab is our screening tab, and this is what houses our financial capacity tool, our quick screener for public safety, and those are the quick questions that law enforcement can ask to see if a person is okay or if they need further assistance getting to a safe place, as well as our AN&E screening to figure out, is there possible abuse, neglect, and exploitation going on, and should they make that report to APS and law enforcement at that time. And sometimes even for law enforcement, you know, it's been helpful too. Is there abuse, neglect, and exploitation going on? Is this not a social service situation as it's often assumed? and is this actually something that needs to be investigated by both APS and law enforcement. So those features help with that as well. That's pretty much it. I know I kind of rushed through it because I didn't have all of my information in front of me, but those are the basic areas of the app and all of the different screenings we have in there. We wanted to put it out as a public service to all of the public so that they can learn more about abuse, neglect, and exploitation and resources that are out there for seniors and other vulnerable adults, as well as to add upon what we're trying to teach in our ACT classes, which stands for At-Risk Crime Tactics Training, that particularly targets law enforcement. It has
We'll do
been
it during
in
the
full
question and
launch
answer.
since the fall. We had a soft launch the year before in only one, I believe it was only on the iPhone at the time, and now we have expanded into the Windows phones and Androids. And so hopefully over the next year we see a great increase in the use of it, and we start to get more feedback on how we can make it better, how we can make changes to it, or if it's working well the way it is. So I'll turn this back over to Dave now so that he can talk a little bit more about EyeOn. Hello? Okay. That Dave would probably have that answer. He still runs our back end, so he should have the numbers of downloads. And I knew that would be a question, and I was kind of dependent on him to answer. Sorry about that.
Can you hear me now? Okay, I could. Okay, great. I could hear you fine, so it was I just hung up and dialed back in, but I'm glad we got it fixed. Before I jump into EyeOn, just a couple of technical issues that related to the GAIN app that Sharee was talking about. So one thing that wasn't evident in that, so what we've done for Georgia is actually created a server side, so all the database and all the information that you've seen is hosted on a single server, and then we've given them administrative access. So we've created some screens, and so that they can actually go in and edit any of that information themselves. So they can go in and add agencies or contact information or change phone numbers. They can even change the screenings, the questions, what gets asked, even the logic of, because the way that it's structured now is we have several questions, and you can create, how is it decided if a referral is made? Do they get one question wrong, or is it two questions, or is it this one plus this one? So there's some logic back there to how is it determined whether it's the situation is fine or the situation requires a referral to either Adult Protective Services or the Alzheimer's Association. So all of that there's a back-end administrative site where they can add and modify those, and it automatically populates to all of the devices, the Windows, the Android, and the iOS is all done at the same time. So it doesn't actually require an app update from the store, which I think is very helpful for these small updates. It's also useful because we are storing all that information. So, who's using the app, how they're using it, how often they're using it, how they answer the questions and the screenings, and all this, and can be generating reports. So we're working on some customized reports for them now on some things that they would like to see on how the usage is being done. So because all of that is not necessarily on the device itself, but managed at a central location. That's fairly easy for us to do. Let's see. And then I heard you were, while I was hanging up, there was a question that came up. So, sorry. And is that did that get answered, or is that something I should address before I move on?
It had to do with, okay.
Okay, that's fine. All right. Okay, I'll jump in. So the other app was the original one, which we originally called EyeOn app. And again, this is something that totally different audience. This is for people living alone. And what we, if you look at this aging in place market, I think it's fair to say that it's very messy. And if you read a lot of the blogs and a lot of the, the Lori Orlov and these kind of things, you can see that there's a frustration level between technology and advancement and actually usability, and there's a lot of things going on. There are a lot of products, and some of them are great, some of them are okay, but there are a lot of them, and some of them are extremely expensive and maybe require a lot of hardware and a lot of training. And so we looked at this market and decided that because there is a smartphone available and the technology should allow us to use these phones, in order to help this aging in place dilemma, we looked at how that could be addressed, and we employed an Institute for the Ages, which is a nonprofit group down in Sarasota, Florida, and we got together a bunch of elderly people that all had smartphones and tablets. And I know that's a question that's come up several times, and I'll address that in a minute. That not everybody does have a smartphone or a tablet, and this app specifically is for people that do, but there is a secondary solution, which I'll talk about at the end. But the idea was, there are no silver bullets. What is something that we can make very effective, very inexpensive, that doesn't require new hardware for the people with smartphones and tablets, and basically, and things we wanted to avoid, and again, this is not a knock on other products, because I think in some situations these other products are very effective, but what we didn't want is something that has a high cost per month, something that also was a proactive solution instead of a reactive solution. So we wanted something that if somebody has fallen and they don't have the button, or they're not able to press it, or they're unconscious, or all the things that would normally happen in a panic button type situation, there are a lot of situations where that just, it wouldn't work. And so we wanted to reverse that and say, you know what, what we want to track is if they don't press a button at the time that they said they would, then that's when probably something is also very wrong. So we got this group together in Florida, and what they wanted was clear, is what they was interesting. They didn't want a human contacting them, even if it was family or someone that they were employed by some call center. They didn't want a person calling them because they felt like it was bothering somebody. They wanted to be able to set their own schedule so they know when they want to respond. Is it at breakfast every morning, or maybe they know they go on a walk every morning and they don't take their phone, so that's a horrible time to check on them through their phone. Or they want to get checked every day except Tuesday because they know they spend the day playing, or the afternoon playing bridge with their friends, and they also don't want to be interrupted, and their friends would know if there was a problem. Or maybe they know on Thursday they spend the whole day alone in their home, so they want to get checked on 5 times a day. So they wanted this ability to control their schedule and also not have human interaction unless there was a problem. And if there was a problem and they couldn't respond when they knew that they could, then of course, human intervention, and they wanted friends and family to be alerted. And that's exactly what we did. And it's basically that simple. We have an app where you can set a schedule of when it gets a notification. We use push notifications. Again, this is Android and iOS. And it's push notifications to the phone that says, hey, are you okay? And you can just slide the bar and say, yes, I'm okay, or open the app and say, yes, I'm okay. And if they don't respond within 15 minutes, we ask again, and it's a gentle alarm. So it's not the same push button sound that you would normally have. It's actually a little bit of an alarm. It's annoying enough to where somebody wants to turn it off, but it's not too annoying where it's going to scare anybody. That was the goal. And after 15 minutes, they get another one. And after a full 30 minutes, if they have not yet responded, friends and family get an email and text message to say, hey, this person has not responded. Please check on them, see if they're okay. And in the email, because we can make it a little bit longer, it actually has the GPS coordinates of where that person was last known, or where the device was at least. And we send that to them and say, please check on them. Here's their location, and they're not responding. And that's basically it for the logic. And when I introduced this to the director of Division of Aging Services, he was like, well, that's great. That's interesting that you did that for your mother, but I see a lot of more potential for my demographic for this. If I can give this free to people, keeping people living at home longer is a huge cost advantage to me. I can save a lot of money. In Georgia, I know it's different state to state, but in Georgia, it's about $13,000 a year to keep somebody living at home, so the waiver. And then if they slip into a nursing facility, it jumps up to, I think it was $26,000 a year or $36,000 a year. It's an enormous jump from obviously moving in their home to a nursing facility or a care facility. And so if there's anything that they can do to help that person stay in home longer, it's an obvious savings and pays for itself quite quickly. Some of the other examples he gave me were the communication between the hospital and the state. So if somebody does inevitably go into the hospital, whether it's for something minor or something major, if they are under state care, the communication for, when that person is ready to leave the hospital is not necessarily good. The hospital is going to say, do you have any friends and family to come get you? And they say no, so they send them to a nursing facility or a care facility. And then, of course, once they're there, it's very hard to get them home. So this miscommunication, it really is by the state as a failure, because they didn't pick them up and make sure that they went back home, and now they're paying the cost of having them in a care facility. So it's these kind of things where if they can find out,
So thanks
where people
to
are
both you,
and how they
Sharee and
are,
Dave, for
and
these
manage more people a little
presentations.
bit better
We
with
have
the
a
use
lot
of
of
some
questions that
inexpensive
have come in,
technology.
so we're going to move over
it's a
to
big win.
our question and answer
Sarah,
session.
who was going to be presenting
Everyone can feel free to send
today,
questions
but
in
couldn't
as
make it,
you think of
unfortunately,
them.
who has
I
these
wanted to
technologies
start,
in her group on
there was a
giving these
question
to Georgia
that,
residents
there's a
and
few
managing
questions
that
about
and training the
cost.
AAAs.
One is what
Has
is the
said that they're
cost
also,
associated with
have not done it yet, but are going
developing
to
an app
launch
specific
this with
to
the
a certain
money
state? Is
follows
there a
the,
range? Is
I'm going to say
there
it wrong, I
some
should look at
kind
her
of
email.
information
You
you can
guys know this
provide
better than I do, but
to
money
give
follows
people
the
an
person,
idea
I
of
think
how
is what
much it
she
would
called it.
cost?
Yes.
But this is an obvious a win if somebody's leaving the facility
Let's
and
talk about
going
law
home
first.
to
The
help
law
them be
enforcement one
monitored and help
first.
them, if there's a case manager or somebody making sure that they're okay, to have some alert that the sooner the better if they're a problem. And obviously we can generate some cost savings from that as well. Georgia has a long wait list, and I don't know if this has shortened or gotten bigger. This is from a few years ago, and this was one of the things that they could offer, because it didn't take any resources from the state. So when they put somebody on a wait list, the message would be, we can't help you right now, but here are some things that we can do for you, and the app is one of them. And again, the push notifications, just like in the other app, is another way of communicating with this group, with this community of being, I guess you could call it monitored individuals, but it's now also another way of sending messages and updates as necessary to this community. And then I know this question came up a few times. Is it required to have an iPhone or an iPad? Well, it's really any smartphone. We are on iPhone, iOS, and Android, and of course an iPad. The numbers are growing. In this age group, there's probably a window. I think everybody realizes that there's a window where this works, and if somebody gets past that, whether it's a certain stage of dementia or whether it's a certain age, using an app becomes probably too difficult. So there is a window where this is useful, and for those situations where there's not, we could easily take what we've developed.
And the question
because,
that came
again,
up as you
like
were
the previous app, this is
connecting
all
back in
on the
was,
server. So we
are there
manage the
any
schedule.
numbers
We're
that
sending
you can cite on the
notifications.
frequency of
We're
use of
sending
the GAIN
emails and
app by
text
law
messages all
enforcement?
from the server. So to get a little bit sidetracked here. So just to give you an example of why that's important is even if the person's battery dies or they don't respond or they've dropped it in the water, we're still not going to get that message that they were okay. So we still notify friends and family that this person didn't respond. It's not actually coming from their device. And why that's important for this stage is we can take, if a state wanted to implement this with smartphones and, for example, text messaging or even a voice call, it would not be a huge jump for us to take what we've got on the scheduling and the check-in and the monitoring and all of that. And instead of sending a push notification to a smartphone, we could initiate a voice call, for example, a voice over IP call, and it's playing a message. This is
Okay,
with
so that's
your
a stay
daily
tuned.
check-in or your 3 o'clock
That
check-in. Press 1
you'll
if
be
you're
able
okay.
to
Press 2 if
talk
you'd
to
like
people a
to
little bit
speak to a
about the
friend and
usage
family or something, or press
once
3 if
those
you'd like
figures
to
are determined,
speak
it
to a
sounds like.
doctor, or whatever those options might be, and we could
And
either clear the message and say everything's okay,
okay.
or make
And
connections as
you
necessary. And
mentioned
of
the
course, if they don't
screenings,
respond,
Sharee, and the
send out
training
that
for that.
same
And
text message and
someone
email that
asked a
says
question
something's
for the
wrong.
screeners.
This person's not responding at the
For
time
the
that they're
screens
supposed
that are
to.
completed
So
by
that
law
could easily
enforcement
be
officials who are
implemented.
using the
As of
app,
today,
are there
it
any
is just
requirements that you needed to do for
the
consent
background,
to
the
capture and then
back end.
share the information? And if that was necessary, how is that handled?
And it's exactly 3:45. So, Sari, I guess you'll be happy about that. I think I'm done. Yeah.
If it doesn't answer the question, if someone wants to write a follow-up in, they can do that. So someone asked if Georgia stakeholders wanted 24/7 APS as child protective services versus law enforcement involvement.
Which app
Did you
are we
have a
speaking
preference
about?
for
It's either one,
APS, law
and just in
enforcement?
general. Right. So a lot of the templates and the background and a lot of that has been built already. So we could, if someone wanted something very similar, but obviously updating it for their state's information, because right now it's very Georgia specific, but again, that's just content in the database. It's very easy to change. It would very much depend on what changes and how much work that would be. But I would guess it would be $15,000 to $20,000 to migrate that and build a very specific app. And that would include, what we do for Georgia is basically end to end. So we have the servers. We're doing the updates for all these platforms every year, making sure they continue to run. We manage the servers. We're checking them, monitoring them and making sure everything is working fine, and keep them updated and keep them running. So we basically do everything from the technical side. The Georgia's IT does not necessarily need to be involved, and they're not involved. And so yeah, so setting it up and migrating it is a bit of a project, and then there would be a smaller ongoing maintenance, to do the work that I just described. So it's you could say probably somewhere, and I'm pulling because it also depends on if it's on all three platforms. Is it iOS, Android, and Windows? If it's all three, that makes it a little more complicated. So there are variables in there that are hard to determine, but I think 20,000 is probably a interesting starting point. It could be a little more, it could be a little less.
Great, thank you. Someone was asking how Maddie's call, the interface, is similar or different from a silver alert.
Frequency, we're actually building those reports now, so it's hard to
Silver
say
alert is
now
for
how often they're using them.
an older
Sharee,
adult
do
who
you
may be
know,
missing
you have
or
any feedback from law enforcement on how often they use it?
No, we don't have any good feedback. That's why we're asking you. We know, that we're getting a fair number of downloads because the code is given out at the end of our classes. We also, just get requests from people who haven't even attended the ACT training from our forensic unit requesting the code so that they can access the broader number of screens within the app, but we don't have exact numbers on frequency of use. Yes.
Yes, those reports are under development right now.
Okay, great. And a question about people who live alone. Have you used this at all with older adults with dementia who live alone, or even just clients in general who live alone? Have there been any privacy issues involved? This would be more for the second app that was presented.
It doesn't do any demographics on the individual who's being screened. So we're just capturing usage, what the answers were, and then we can only right now correlate that against reports from law enforcement. So it doesn't directly feed into us any information about the person being screened. I hope that answers that question. Well, as I said earlier, we are not currently 24/7, and for a number of reasons. One, we don't consider ourselves first responders. The types of investigations that APS does versus law enforcement, we're investigating according to our code for the need for services. So, figuring out what's going on with them, what's putting them at risk, and what can we implement to keep them from being at risk in the future. And so it's not
was about the live
necessarily
alones.
something that needs
There's a few
24/7
questions
involvement.
that are
But what
asking
did need 24/7 involvement, and the cries that we got from the law enforcement community,
who's using it,
is
who
that
lives
they
alone.
needed
What
assistance
groups of people who live alone are
in
using it?
figuring out what was going on with people sometimes, because they felt
Yeah,
like
dementia,
they didn't have the
non-dementia.
knowledge base or the training, or they didn't have access to the resources like our turf funding in order to get someone placed in the middle of the night on the weekend that they encounter, who definitely does not need to be in the hospital, but they do not need to be left home alone. And so through parts of the app, we are trying to answer some of those needs that law enforcement had by giving them screening tools when they're in a bad situation in the middle of the night, not sure if they should let this man in his pajamas keep walking, or when they encounter vulnerable adults who are alone and need some form of care. That the app is hopefully helping them meet those needs that law enforcement has when APS is not at work. I'm not really sure what the silver alert is. So, but go ahead. And Maddie's call may be just the term that we use here in Georgia, but it sends out that once law enforcement initiates a Maddie's call, then the messages go out on the billboards. You get those pop-up messages in your smartphones at the bottom of your television screen, so it starts that whole process going.
Right, I want to just
so
get to
if
one more question before
already
we have to
in the
close
app,
out.
using the app,
Can the
it's
user be
just
proactive and
a
actually
button hit
send
that they get connected to the
information
Maddie's
to
call
the
versus
system as opposed to waiting
calling
for a
back into their
check-in?
dispatch or getting the number from another area? If they're within the app, it's a one-button click for them to connect into that, start that process.
Great, thank you. So
Right.
we
People are
have
we definitely have
run out of
usage and
most of
people
our
using it.
time here.
I
Dave or
have
Sharee, do you
thought
have any
about
closing
privacy. I
thoughts that you
don't
want
know if
to
there's
provide?
anything, we definitely had any problems with that yet. They do need to opt in.
If anyone
If
has
you know, I guess the privacy
questions,
would be the location. I don't
okay.
know if that's what somebody would be worried about, but that can be turned off where they're not displaying their location to their friends and family. But no, nothing has come up negatively. We've only basically had positive feedback. You know, I've got one story. Maybe this is not the best time, so I'll try to make it quick. But during that customer feedback session we had in Florida, there was a woman that her son lived in New Jersey and she lived down here, and they would have weekly conversations as well, but argue a lot about, you know, her living situation, and he wanted her to move into a community and she wanted to stay in her home. And she implemented this app, talked to him about it, explained to him, and she came back. She actually called me. She found my number somehow, found me and said, hey, I just want to thank you for helping my relationship with my son, because we now don't talk about where I live. You know, for now, he's got more peace of mind. He's relaxed. And so that's generally been the had, and not privacy issues. And I forgot the first part of your question. The privacy was the second. The first part was...
Great. Thank you so much again, Dave, Cardell, and Sharee Rines for your presentations. Again, everyone, if you see in your closing notes at the bottom of your screen, if you have questions, you can direct them
dementia. I think
to
you
me,
mentioned
Sari
dementia.
Schumann. If you have feedback, you can send it to
Yeah.
Aaron Long at
I'm
ACL.
not
Both of our email
sure
addresses are
if
in the
the
closing
users
notes.
have, you know,
And
early onset
we look
dementia
forward to
or
having you
Alzheimer's.
join us again for
You know, that's
another
not something
webinar. But at
we
this time,
generally
we'll
know.
close out for
I
today
think
and say thank you,
any type
everyone,
of
for joining
technology,
us,
though,
and thank you to our
I tried to
speakers for
address
your
this in the
great
presentation,
presentations.
I
Have a
think
nice
at some
afternoon,
point it
everyone.
probably becomes too difficult. I think until that time, it's extremely helpful. It's extremely useful. But I think that obviously there's going to become a point where this particular app